Welcome to Studio 58A live here at the Jamaica Information Service, our discussion program coming to you live on Facebook. I'm your host, Vaughn Davis. Welcome to those of you joining us wherever you are around the world. We really do appreciate it. Thank you so much for your eyes. And like how we have your attention, do us a favor, no man. Share this video with a friend or two or 10,000 so we can have a very lively discussion. And don't forget to send in your questions and your comments. We like that, all right? Now, non-communicable diseases. By now, I would think everybody in Jamaica and probably all over the world should know what those are. But just in case you don't, it's an illness that has a long duration and is caused by a bunch of factors such as genes, environment, or behavioral factors. So we're talking about illnesses like diabetes, hypertension, and cancer. Things that for now have no cure but can be treated with a combination of medicine and lifestyle changes. NCDs are the leading cause of death globally, but they are particularly threatening in lower income countries like Jamaica, right here so. And we can't afford to keep losing our people from these illnesses, especially when we have the power. Each of us individually has the power to do something about it. Here to give us a refresher on what we can do are Dr. Cathi-Ann Williams, the NCD Risk Factor Program Development Officer at the Ministry of Health and Wellness, and Ms. Takese Foga, Director for Health Promotion and Education, also from the Ministry of Health and Wellness. Welcome to both of you, ladies. Thank you so much for being here with us today.
Thank you. Thanks for having us.
Thank you. Thank you.
All right. So I guess let me start with you, Dr. Williams. NCDs, as we've said before, we've been hearing a lot about them for the past couple of years. And, you know, sadly, it feels like the numbers aren't going down. It's like, so it tells me that behavior is a big part of the thing. But before I even go and asking you some of those things, give me a snapshot. Give persons a snapshot on what the situation really looks like from a medical person, a trained medical professional's eye, as to what the situation looks like in Jamaica as far as NCDs are concerned.
Okay, and thanks for that. We talk about the epidemic of NCDs. And just to start out, public health has come a long way. So in centuries back, we would have been battling for the greater extent communicable diseases. We didn't have advances in public health as it related to infection prevention and control and immunization, etc. So we've had those under control for a bit. We have epidemics every now and then for communicable diseases. But now we look at non-communicable diseases, and they are associated with a lot of the deaths or mortality in Jamaica. And when we look at the top 10 causes of deaths in Jamaica, non-communicable diseases feature very heavily, or strokes, or diabetes, heart disease, chronic respiratory diseases, etc. So it is an issue. The Honorable Christopher Tufton, or Honorable Minister of Health and Wellness, would have addressed it in his sectoral speech recently, the issue of tackling this epidemic of NCDs. And just the numbers speak to it. The Jamaica Health and Lifestyle Survey, Minister would have alluded to, wherein 1 out of 3 Jamaicans have hypertension or high blood pressure. 1 out of 10 Jamaicans have diabetes. 1 out of 50 Jamaicans have had stroke. And we look at stroke as the number 1 cause of death, as death in Jamaica. So strokes or cerebrovascular accidents are an issue. So we may not talk about it as much the public may not talk much about non-communicable diseases. We probably accepted it, but they are an issue. They are a leading cause of premature death that could be prevented. And it's definitely something to talk about, and we're grateful to be here today.
All right, wow, that's scary. I mean, but it's useful information, because I'm pretty sure many persons wouldn't necessarily have figured strokes as the number 1 cause of death. So we're stick up in there. We're gonna come right back to that, because we want to drill some more down into that. But Ms. Foga, I want to ask you, as a Director for Health Promotion and Education, it's one of those things like, we know we need to do better. We know.
True.
We know. Why we're not doing better? What's going on? When you sit down and craft these messages to send out to the people and try and let them understand what's going on, why it's like when I hear Dr. Williams just mention a while ago how NCDs do, and the stats just frighten me. So I would like to think I should change my behavior. But yet still,
Right.
it seems like it's an uphill
Right.
battle. Why is that?
Why behavior change is a very difficult thing. It takes a while, but it's a study. It's a science in itself. So you have to understand the behavior. So it really takes a lot of um, targeted interventions with target groups. So as our concerns are raised, or as the statistics, the data may point to particular groups. So we have our children, and we see that there was growing obesity. And so part of what we know we had to do was to be working with education to promote an environment that it's there with them, because how else. So, for instance, when you facilitate that we're only going to have water today, that's
Mm,
part of trying to encourage, okay, they don't have no choice. It's just water being sold here. So we're going to be drinking water. And then you sort of develop well, this is not so bad. And this actually work out. You know that thing. So
mm,
because it's behavior, it's really understanding, as you said, why? Because it's not just I'm not everybody is convinced that because they're hearing all these statistics, it's going to affect them
mm.
individually. So yeah, man, it's going to affect my mother, my auntie and stuff, but not me. And so you're dealing with that. And then you have to relate. No, you look at your risk factors and you determine, no, why are they not doing exercise? Some of them associated just with something that just difficult to do. And so it's a study to look at what can I do with them now to show them, look, so you've tried to find out what they enjoy. Because there's always a chance that there's some activity they do enjoy.
Mm.
At basic, it could be dance, and it could be just they do it without even knowing they're listening to their favorite music and they're there moving. How about doing that a little more than just a one song? Let's try a few songs now. And before you know it, you've done a half hour workout session doing that. So it's really getting into the psyche. It's really trying to understand why they are doing something. And the truth is sometimes we do take for granted that they understand.
Mm,
Because I've
mhm,
seen nutrition go there, and when they make it plain that okay, you're eating or drinking a particular thing, and they fill it up with the amount of sugar, the amount of salt, and you're seeing visibly what you're putting in your body. I've seen where people do a double take, like, really, did I just put that in? Because of course you're showing them something that say, like, let's say it's one drink and they know they have just already consumed four drinks and
mm,
we don't even reach half of the day yet.
mhm.
Then they're like, oh my goodness. So it's being able to do things that demonstrate, identify, and work out through the behaviors.
And it's fascinating to me because, like I said, you asked the question of why, and I guess I want to drill down further. Is there any information or even anecdotal evidence just from the work that you've done up to date to show
Sure.
where the biggest, I would say, resistance is? I know that children, it's hard to get children. I would like to think you kind of have to start breaking the habits from them small. So people get used
Right.
to developing, proper eating habits, lifestyle habits, exercise, that kind of thing. But then I know for a fact that you have some very, very stubborn elderly people
That's
who
true.
determine that, look here, no man, yeah, me I say, no man, me drink my tea with 4 scoop of sugar. And I just saw me
And
know it.
that's it.
I saw it. You know what I mean? And then I
Yes.
forget the big piece of bread or whatever. You know what I mean? All these habits that they've cultivated, and then so
Right.
when you I just want to know who get the most trouble in terms of when you're going out there for put a message in.
Wow. That's kind of a hard one because it depends too on whether in country or town. It depends whether in school or community. You understand? It's because within each grouping, there is there is resistance. So I definitely have met the ones who, like, I'm not going to do anything different. You could attack, but I've watched some of those same persons have diagnosis by the doctor, and all of a sudden lifestyle change.
Exactly. And that's
You
not that's
understand?
what
And
that's
I'm
yeah.
not even talking major, as in cancer or stuff, not
Mm-hmm.
even that, but just recognizing, boy, the pressure is really up. And the only way you need to, and it's not even just medication, it's about, doing more activity, watching what you eat. And I've seen it and seen people have done it and actually maintained.
Mm-hmm.
But it took that little scare to do it. And unfortunately, in some of the cases, that's it. But of course, from our perspective, we try, we hope not to get to that point in scaring them in that real way, but just letting them recognize the importance, which, as you said, sometimes it becomes a talk shop because they just think you're saying it. But to the extent you can demonstrate, as I gave you the example with the nutrition, you're showing exactly the amount of sugar, exactly the amount of oil. That makes a difference. Because when you're eating, you don't even stop to think about some of the things.
Yeah, that's true.
And that's why even teaching labels, becomes a conscious of certain things that you just take for granted. I can eat off a raisin bread or a bun in little, but then you start realizing that just the bun or just the raisin is 3 portion, and that 3 portion, you start calculating.
Why, Miss Foga, you draped me up a while ago. I don't appreciate you. You cannot come on my show and drape me in such an aggressive fashion. Okay? I like raisin bread. You know
I like it too, but I'm just saying, I realize that to eat it, I can't just go one at a time if I'm really trying, or if I have it, I just need to know all of the other plans that I had to eat. I have to go cut down, because in that one alone, and let us not even go and touch some of the fast food meals.
Yeah.
Which in one go you got nearly 3/4 of your
daily
requirements for the day. Exactly.
I don't want to lose any more people to jump off my life, so I'm going to press pause on that. I'm going to press pause on that, right? Let me just big up some of the people who checked in. Donna May Lewis Lear said, Medea from Florida. Big up for yourself, Donna. Really appreciate you for tuning in. And if you have any questions, anything you want to add, any comments, just drop them in so we can incorporate you into the show. Remember, this is the people show, and we want to hear from you. We want to talk to you. We want to hear what you're doing. And if you want to share some of your suggestions for how you are trying to stay healthy and keep the NCDs at bay, feel free to do so. Drop something in the comments, man. We want some interaction today, all right? Shani Bud saying scare statistics, all right? So already, Dr. Williams, you see, already mission accomplished. The day just started. You already let people know. Said Shani Bud says, I miss Jamaica moves. I don't think it gone anywhere, Shani. I think, things just reconfiguring, like how we're just coming out of COVID and so on. So
that's correct.
The rules of engagement might have to shift a little. So you give them some time. Things have to work out.
Soon see a whole lot of things coming
Exactly. Out. See there, Miss Foga said, whole heap of things soon come. Pat Booth says from Howell's content. Tell me which parish or wherever that is, Pat. I really want to know, all right? Shani Bud says she's watching from Jamaica. Really appreciate that. Alfreda Williams says watching from Longsville, Clarendon. All right, big up Clarendon. And Shani again. She's like, Shani says she's having trouble with mango season. You are not alone. Trust me, Shani, you have a whole heap of company over here. Trust me. And she was saying that the older people will tell you they have to die from something one day. I responded to one recently and asked if they wanted to be sick unto death, and that stopped him in his tracks. You know what I'm saying? So, yeah, the message sometimes you can use a feather,
you have to use scare tactics,
but then sometimes you have to use a sledgehammer and let people just have it. You know what I mean?
That's true.
All right, so Ministry is bigging us up. Thank you, Ministry. Really appreciate that. And Pat Booth says, from Clarendon. Thank you, Pat, for tuning in. Now, I want to bring you back in now, Miss Williams. Now, let's just, before we go even deeper into the conversation, what can people do to keep the NCDs at bay? I mean, it's always good, it's good to let's just establish what we should consider, what are some of the ideal behaviors and lifestyle choices that we should be making to start putting ourselves in the best positions to dodge the different ones, dodge different illnesses and so on.
Okay, great. So we talk about 2 main things. We talk about prevention and screening, and we look at our risk factors for non-communicable diseases. And so our risk factors, one would have been mentioned before: physical inactivity, unhealthy diet, excess use of alcohol, tobacco use, and another factor that has come in recently is air pollution. Okay. So we look at those risk factors, and then what we try to do as a ministry is to let persons be aware of their risk classification. Where do I fall? Do I have a family history of diabetes? Do I have a family history of hypertension or cardiovascular disease? How old am I? Am I overweight? What category do I fall in? And based on those, we tweak our behaviors accordingly. We spoke, would have mentioned about behavioral change, and it's so difficult. And persons are at different stages of change. The persons will jump on, the early adopters, persons will lag behind, and there'll be persons who will follow other persons and that kind of a thing. So we have the risk factors on board. And so to counter these risk factors, we ensure that we have our exercise. We mentioned Jamaica moves, and we have stipulations at our ministry, recommendations on exercise, which we'll probably go into a little bit later, based on age group. The healthy diet as well, would have mentioned before, eating healthily or fruits and vegetables in the appropriate servings, reading our labels and seeing the salt and sugar and carbohydrates and protein content and making good choices. You know, we have the Better For You initiative, where we have on board some of our fast food restaurants, highlighting some of the healthier choices on among their options to help our public as well with those healthy choices. Tobacco smoking is a risk factor. So if we haven't started smoking, don't start. And if you have started already, we do have support services available through the NCDA and the Ministry of Health.
Yeah, but Dr. Williams, what about weed, Dr. Williams? I mean, tobacco different, weed different from tobacco, don't it? Weed is the healing of the nation.
The weed discussion is controversial, specifically as it relates to non-communicable diseases, but I'm a healthcare practitioner, and so the answer is no. I know our mental health team will be able to throw in a lot more facts than probably I can in this setting. But specifically for non-communicable diseases, we look at tobacco use, and I'll just leave it there as it relates to smoking.
Okay, yeah.
So we have those behavioral changes. Ms. Foga can probably back me up if there's anything else from a health promotion and education point of view in terms of that change. But definitely those risk factors and the things to counter it.
All right. Well, let me just show some love to Alfredo Williams, who jumped on. Well, Jasset Jackson Johnson says, watching from the UK. Thank you, Jasset. Really glad that you took the time to watch with us today. And Hopi Belvit watching from St. James. Thank you, Hopi. Really appreciate that. Now, Alfredo Williams saying, the smokers usually say they've been smoking since they were kids, but they don't realize how differently the tobacco companies are doing things. Different chemicals that are more addictive, which is very true. None of us, how many of us actually know what's in some of these cigarettes that we're smoking? In the same way, how many of us know what's in the juices and the snacks and all the different things that we're consuming and putting into our bodies? We do have to be a lot more vigilant in terms of the things that we choose to eat and so on. But let me ask you this. What I think for me personally, one of the gaps I find in the not so much the messaging, but the overall presentation of what persons should do to avoid or keep NCDs at bay. Sometimes there's a exercise but it's almost like people don't have a frame of reference as to what that looks like. So for example, it's easy, you can come to a person and say, eat a healthy diet or whatever. A person might just think that means eat a whole heap of vegetable. But suppose me not like vegetable. How do I craft a meal? You know what I mean? And if I'm a big person, I can't eat vegetable. I'm not a rabbit or something like that. I can't eat pure vegetable. You know what I mean? So it's like, what does a healthy diet actually look like? What does that translate to? What does a healthy lifestyle look like? Because many persons genuinely don't know.
I'm glad you asked that question, because that's part of what we actually do. So even as you mentioned, that I was looking here at some brochures done by a little flyers, healthy snacking tip, healthy eating on a budget. So they do have some, we understand those kind of things that you're saying, what in terms of what the meal looks like. So what we tend to do is in our, say, community events, and I'll agree, we probably have not been able to be out as much. So we are trying to now develop a lot more videos that can be shared, in spaces that our limited human resources can reach, to show like demonstrations. So you would find that we have had many activities, and we always ensure that we have a section that highlights the healthy eating, one that deals with the physical activity. We usually do some screening because all of those are just so significant in this fight against the NCDs. And so what you have, what we would normally do is actually show people, even when we say serving, I know that's something you don't generally understand just like that. And so what we would do is, actually be showing the real thing. So you show a dinner plate and you look at your carbohydrate, your meat, your different things and what it should look like. And so you're right. We haven't probably been able to do it as widespread, but we are building up our resource materials and certainly moving towards doing a lot more of the video type and things that people can see, because we know the practical is so important. And even if I think of physical activity, we have guide for the workplace, we have guide for the elderly. We have been trying, we have guide that the church can use because there's many opportunities in any faith-based organization. So we had started with a Bible. We did that a couple of years ago, and we just moved for health. They launched one with Muslims because, they may have different practices, but, basically you have an area, you have a big group of people you have influence over, and you already believe in your mandate that this is physical health is important. You understand? So we try to be, the way to get it is to be very targeted. And you're right, in a forest such as this, where you also are getting in some of the questions, we recognize, that's why I know nutrition is looking at some of the food labels and, helping people to understand, because that has come up in a lot of, discussions and presentation. What is really in here? You ask that, you say, well, boy, we're eating these things and we don't even know. And so being able to explain in a very simple way, how, what is in our food, what can impact us, how you go about choosing things, and also not coming to the conclusion that, boy, if it's healthy, it's expensive, so I can't go healthy.
That is our next part of the
Right.
conversation we have to look at.
So the nutrition team is working heavily on showing how you can, eat healthy on a budget. And just in terms of the choices that we make, the kind of environment that you have around you is so important. And that's why, especially in schools and workplaces that are a little bit more controlled, we have to work along with persons there to see, do you have a canteen? And when you have the canteen, what are you really selling there? In terms of what people can get and stuff. And that when you work along that way, you are already forcing an option, I suppose, healthy options on people. When you make the workplace a place where, there's a 5-minute period where through the intercom you hear something going and you can get up and do some stretch breaks, or you make it a policy that no meeting should go. Once you reach an hour, you need to stop and take a stretch break and move on.
All right, yeah, I like how you're thinking. Those things sound very intriguing. The sit down and the sedentary lifestyle we need for, boy, I tell you.
We have a video showing people some simple things that you can do just at your desk.
Yeah.
Because we can't say, sometimes a lot of us, we might spend quite a few hours at our desk, but we can get up and do some simple squats. Simple squats that you can do. You can even, in our video, we show for the women, and our bags tend to be very heavy.
Yeah.
So you just move in the bag from one area to another. For you do it a few times or 3 sets of 10, you're getting in something there. We can get in standing. I'm standing as I'm speaking to you. And, part of that is important.
Exactly.
Not these, so there are practical ways. And yes, through collaboration with persons like yourself, I know you will help us to get some of those practical ways and tips out.
Yeah, man. Yeah, Shani, Shani, I love your comment them. All right, Shani said, listen, that thing about serving that Miss Foga mentioned caught me, My doctor always tells me to have 5 servings of fruit, especially when I'm ill. I thought she meant 5 whole fruits until recently. # tiptoes away with mango. Shani, Shani, keep them coming. Yeah, yeah, spice up my program. I like it. All right. And if you have a friend or a sister or brother, so tell them to jump in on the conversation too. All right. Now, Dr. Williams, I feel like I want to put you on the spot. Bear with me, but I have you here, so I'm going to ask you. What we must eat?
Okay, that's the question.
I mean, it sounds simple. It's like it's just you go in the fridge sometimes and it's like, okay, I don't want to eat that. I could drink some juice. No, wait, that is like I find sometimes I get into this analysis paralysis thing when it comes to food, because you open the fridge and say, all right, I want to eat something. I want to eat something healthy. And you look at everything that is there, is like, no, I can't eat that because I just eat that. I just eat some bread, so I can't eat any more starch, so I can't eat any biscuit, or I can't eat any crackers, and I can't eat that. So and then you get, like I said, you get into this frame of mind where everything you look at, like, how can I approach food in a way that takes off all of this anxiety off of me, that I can eat freely but still feel like I'm eating in a healthy way. From a medical perspective, what do you recommend? I mean, obviously, it will vary depending on my personal challenges and my physiology and whatever is that, whatever I'm predisposed to, like hypertension or diabetes, that kind of thing. But from a generalized perspective, give me some advice.
Okay, let me go for it. Hats off to our nutritionists and our dietitians here in Jamaica. They're doing a great job, and they are present in our health facilities, and they have discussions with clients going to the health facilities in a way to have a general way of tailoring their diet. It may not be very, very specific, but a general idea. And the starting point that nutritionists use are the food-based dietary guidelines. They're available on our website, moh.gov.jm. And essentially, as Ms. Foga mentioned, there's almost like a plate. It's a plate essentially, and it shows the servings and the proportion of different food groups that is recommended, the proportion that is recommended. So we have our fruits and vegetables occupying a large part of it. We have our proteins and we have our carbohydrates. Sorry about that. So when we do that, we can start there. And so for someone going into the fridge, we look at those food groups. We look at our carbohydrates, our sugars. We look at the salt content. We see excess salt as a risk factor, as it's associated with hypertension. We know that diabetes is uncontrolled sugar levels. I've again plugged for reading our labels. So we know that we have that propensity towards high blood pressure. We're using the low salt product. The same mango season. You're not obviously not having 5 mangoes as some persons do. You're cutting back accordingly. Christmas time, we're careful with our Christmas cake. And so it starts with knowing your risk classification, knowing where you stand based on your family history, whether you're obese or overweight, and then looking at the food group and being guided by the food-based dietary guidelines that we have here in Jamaica. Always speak with your healthcare practitioner, your nurse, the nutritionists that are available. Our website is available as well. There are lots of products from the Health Promotion and Education Unit that helps to guide the population as it relates to good dietary choices. And again, we have Better For You initiative with our fast food restaurants as well, about making those choices. So to put it together, our risk factors and our food groups, and being guided by the guidelines according to the food groups. Can't hurt with fruits and vegetables, though fruits and vegetables do have their sugar within them as well. So it's a balancing act, and the food-based dietary guidelines help with those decisions. Hope that helps.
May I add something?
Sure, go ahead.
Sure, please.
Okay, not a nutritionist or dietitian, but just, something I know they always say is that, it's not that they're telling you to stop any food, generally speaking. It's really about the portions that you have and also the way you prepare. So we know that it's sweeter the more the oil in there. And we're trying to say you need to cut back on the fry up. And even with the stew, sometimes we just put in a whole lot of, the oil. We add salt when generally speaking, our food, certainly our meats, have already salt within it. And so it's being careful of that, and not so much from what they have, said in many of their presentations, we are not telling people, don't eat this, don't eat that. We're saying, be careful of the portion. So it's not that they're even saying, boy, you can't eat chips or stuff, but you have to recognize, having eaten one, you know, taken in some salt, you've taken in some oil and stuff. You be careful of, you know, the other foods that you're eating for the rest of the day. So we really ought not to feel too, you know, in prison
Anxious,
or
yeah.
like you, where you
Anxious
say,
sometime when you go into the fridge and you look and you just can't make up your mind because like, sure, I don't want any lettuce or no this or no that. But I can't eat, no, I mean, I ate whatever for breakfast, so I can't eat any more of that for lunch or
Right.
whatever. And so it just becomes this whole vicious cycle. But let me just
and
show.
then for some persons, just sorry, just to say that it's also just, you're just cutting back. So some of us may have three big dumplings, just as an example. I might go down to two, or we eat, you know, it can just be just starting by cutting back, not changing necessarily. And of course, you all and Dr. Williams did a good job of speaking to our risk factor, and so we have to watch all of those things, because some things we will cut out based on what we are prone to. But in the general scheme of things, it's really just cutting back. Some of we just eat too much sometimes.
All right, you're not wrong on that one. Let me just show some love to people on the online. Elaine James, thank you, Elaine. Elaine is saying, I'm a certified dietitian slash nutritionist in the USA. What I find in my practice when I'm dealing with people from the Caribbean is that it's very difficult for them to deal with diet restrictions, especially for diabetics, because our diet is so heavy with carbohydrates and starch. If you look at a Jamaican person plate, most of the time you'll see the banana, dumpling, yam and dasheen. That's enough for 4 or 5 portion. Elaine, why you don't want me and you to be friends? I don't understand what's going on. Elaine, what you mean? You say like Elaine, that just sound like the right. You have your yam, your banana, your dumpling. You have all of them. It's like a nice little family upon the plate and everything look good. So I don't know. I don't know, boy, Elaine. Dropping some. Feel like dropping some more stuff in the comments so we can have a better idea of some of the advice you give persons from the Caribbean that you deal with to help them better manage their diets and so on. Cleveland Coombs saying he's representing from London, and he's saying it's good that there's an organization in which that introduces healthy eating, because I think a lot of people in Jamaica eat and drink too much sweets. Sky Juice, Suck should limit, advertise about healthy eating on TV. I'm sure the ministry is right there with you. And there's a lot going on. You know, we can ask Ms. Foga to talk about the plans to, you know, especially in schools, to restrict some of the items that are sold in schools into the school guidelines and the diets and that kind of thing. Not to mention the plan to kind of reduce the amount of salt in our juices and then reduce the amount of sugar in some of the sodas and other drinks that are sold and that kind of thing. We can stick up in and come right back to that. Shani, but again, love Shani. She's saying, I feel like Dr. Williams talking about me and the mango, you know. I am seeing a great dietitian and making better choices, not letting diabetes take me out. I'm fighting back. And that's great, Shani. That's what we want here. Really glad about that. If you feel like it, give diabetes a thump in your belly for me too, all right? just take one for me, all right? No problem. Alfredo Williams is saying, this question is for Dr. Williams. Mr. Host, I only eat chicken and fish. On a radio show in the USA once, an Indian doctor said beef is the only meat that does something particular for your breathing. Is there any truth to that, considering that I used to only eat cow foot or oxtail? Dr. Williams want to weigh in on that one? That one seems that, it seems our beef, the meat debate here.
Was the comment that beef does something for your breathing?
That's
as
what
in
it says. It says, once an Indian doctor said beef is the only meat that does something particular for your breathing. Is there any truth to that?
I am not aware of that fact. I'm not denying it, but I'm not aware of it. But he did mention eating chicken and fish only. We'll say again, it's about a balance. So chicken, fish, good source of protein. Fish is a good source of omega-3, the good oils that are available. omega-3 and the other number 6 and 9, I believe. Red meat is a good source of vitamin B12, so beef would fall into that category. But as it relates to specific to breathing, I'm not aware of that. I can read around it and see, but it's about a balance. It's about a balance. And so even with persons, I think about who are vegetarians, it's also very important from that point of view. If you are just on vegetables alone, and there's not a balance there in terms of vitamins and so on, there is a risk of vitamin B12 deficiency and even folate deficiency in some cases. So it's about that balance. It's not, and this issue of diet is very important to have a medical consultation and be guided, and so that you're making the right choices for you. Everybody's body is different. Your metabolism is different, how your body processes food, your weight, your genetics. And so while we're making these healthy choices, we have to balance it with good medical advice so that we are nourishing our bodies in a healthy way.
All right, let me just quickly run through a couple of the comments that we have. Cleveland Coombs again, thank you again, Cleveland, saying hard dough bread consumption should also limit too much sugar. And Shani backing him up, saying she was shocked at the sugar and salt content in so many of our foods. And Cleveland again saying people should drink lots of water. Yes, dumplings should be limiting consumption. Cleveland, don't judge me, all right? Don't judge me. How many dumplings I eat is between me and the plate, all right? But
and your doctor and your nurse.
So why you want to bring me down, doctor? Don't bring me down. I mean, like, I'm working at it. I'm a work in progress, all right?
No judgment here.
No judgment. It's a judgment-free zone. Melodic Hammock saying, how many times a day should you have a meal? I guess that's an interesting question, because there are, the age-old adage is 3 meals a day. But is that like what's that based on? Is that actually, does that make sense for everybody? You know what I mean? So let's dive deeper into that, Dr. Williams. What do you say?
Okay, it's based on you. I'm reminding myself about what our nutrition team would have said, and probably back me up. But I know specifically for persons who have non-communicable diseases, it may be that it's more than 3. So it may be even 5 small meals that are guided in terms of nutrition for that particular person. For example, diabetic persons, their sugar levels can go down, or they may have those hunger pangs and so on. So they're not starving until lunch and then starving until dinner. There are healthy snacks that can be instituted in between. So it will vary from person to person. And again, medical advice for you to guide you according to your health profile, your weight, and that kind of a thing.
All right, now I want to bring you back in, Ms. Foga. I want to talk to me about some of the different initiatives, as we just mentioned a while ago, the different initiatives being undertaken to help spearhead our ways to get our population actively working to help and work in partnership with you guys to bring down the level of NCDs across the country. We mentioned Jamaica MOWH is one of them. We know that there are plans to, alter the diets that are served to the children in schools. There are plans to reduce, tackle salt content in our foods and that kind of thing. But let me not steal your thunder. Go ahead with it.
No, you're doing a good job. All right, so when we think of Jamaica MOWH and just overall health promotion, we want to think of the different settings, we call them. And we're thinking schools, workplaces, communities. Of course, communities is wide. Let's start with the schools, and you mentioned some of them already. The aim is that one thing when we're tackling behavior, how supportive your environment is can impact the behavior. So one of the things that together with education we looked at is the incorporation of fruit days and water days. And I would have mentioned that earlier. For physical activity, it's incorporating physical activity breaks, because again, if you don't have a good mix of your eating and your physical activity, there is a challenge. So some of us are the impact of the eating is even that much greater because they're not doing any activity along with it. So that's a challenge. So we have recognized, the Health and Lifestyle Survey done in 2017, 2018 sorry, 2016, 2017, showed that only 2% of persons were doing like high level physical activity, which I mean, so our concern is moderate. 16% were doing moderate, which meant that 82% were doing very low intensity
Percent.
activity. Thanks. So that means that is just accounting for me walking to the car or just, nothing, exerting energy. And so we've incorporated work together with education to institutionalize 3 physical activity breaks per day. And that can just be done in their classroom. You just take 5 minutes, and guess what, it has additional impacts because it impacts your mental health. You're de-stressing, you're refocusing, because in school it's very easy to get distracted, so it
Yep, yep.
refocuses, so it plays a whole lot of effects. So working together with them to get in those measures. And you mentioned it already, the sugar, reducing the sugar in the drinks that are sold, because again, it's the environment. What is the environment contributing or helping? How are we helping? It's been capacity building with even the vendors that work along with the school in terms of what it is that they are selling to our children, and of course leave out the teachers, administrators, because it's everybody, right, that is impacted by what you have. With the work. And I should say that we do have capacity building from time to time through the Parent Support Commission and the National Parent Teachers Association, where we try to get parents, because it's one thing that you create a supportive environment at school, but when they go back home, it's a totally different thing. And we're trying to get them to be both on the same page. As it relates to workplaces, again, we've we've developed guides. One that shows, I have it here, the healthy eating, how you can do health guidelines for healthy eating in the workplace. And we also have a toolkit and guide for physical activity in the workplace as well. And basically, it's really, when it comes to the physical activity, it's just showing how you can, even if you don't have a gym at your workplace, one, you can, if we talk about spaces that you can utilize that may be nearby, you work together with the community. But outside of that, it's minimizing the use of elevator and using the stairs instead. So we have a corporate wellness manual, actually, that we work along with the HR coordinators of workplace, and just show how little things can be done to just incorporate good measures without even spending a whole lot of money, because what you do at your desk is no additional money right there. Doing stretch breaks on a regular basis, utilizing your intercom, whether school or at the workplace, to just say, let's do this break right now, or you show some activities. And of course, having healthy competitions even within a particular entity, or along with others. So through Jamaica Moves, we would have done corporate challenges, and the excitement of my staff against your staff, and but we're all together doing something that is healthy. And once you start it, you end up incorporating it. I'm very passionate about what I do. I know what it is. I lost 30 pounds while I was here, since I've been here at Ministry of Health and Wellness. And basically, it was just learning to incorporate the physical activity,
We're not going to
watching
just
what I ate.
speed past that, Taki. We're not going to just speed. There's a little humble brag a while ago. Let's give you an applause. Third, you know how it is for lose one? You know how it is for lose one? And you lost 30. That's amazing. That's kudos to you. I'm sure that required dedication and a lot of commitment and a lot of effort. So let's just take the time to salute you. Good job on that one.
Thank
Really,
you,
know what I mean?
thank you. And it speaks to support groups too, because a number of us really decided, by if we're promoting it, we need to be practicing it. So we just started to do, some activities. And then guess what? You see, when you start feeling good, because physical activity, eating healthy, seeing how your body just feels good, and the change, and people giving you a kind of comment, boy, you're looking so good. Boy, that is motivation to just keep going. I'm not saying I don't have my little struggles here and then to keep to sustain sometimes the physical activity programs and stuff. But thankfully, I have not gone, in any significant way back. I've tried to maintain, but it is the environment that does help a lot with it. With communities, we're looking at target groups. So, like when we speak about the elderly, we work with entities such as National Council for Senior Citizens, and through them, sometimes we have some special events where they come and we can, show them demonstrate some tips. We developed a video with them, and I tell you, I'm so impressed about it because you have people in their 80s and 90s showing you how you can do a push-up.
All right.
And you understand, and just how they eat. So having those videos and being able to share with others has been good. It started actually with doing a guide, so a booklet, and then they asked for more demonstration, because you always say sometimes, or you were saying earlier, seeing the practical things. So the guide itself was good because it did show a lot of pictures, but then actually seeing people doing it also, of course, was then very helpful. I should say, even going back to the school where we have the physical activity breaks, again, we're always about showing people how to do it. So we have a whole booklet that says, we don't want anybody to say, but Lord, the 5 minutes, come on, I got to do for the 5 minutes. Show them little game, little things you can do, and before you know it, the 5 minutes done. So we do the booklet, and we are working on some actual videos that show you different ways you can just engage the students in 5 minutes of physical activity. And sometimes, of course, it might go a little further than that because you enjoy it. And so really, we've just tried to be working with different groups, with entities, just utilizing resource materials, doing some capacity building, just educating, and more than anything, the demonstration. So, as I said earlier, people think, why the physical activity? Lord, I can't do it. And then we have some creative people we have worked with who show you how in the office you answer the phone, how you can be doing some movement while so just different things, different ways. We have to just be, when you're promoting health, you have to be very creative and innovative.
Absolutely.
And we are always welcoming of feedback and different ways, because we have to learn from the people we are targeting, because we've done some things and the children say, you could have done that now reach me. This is how you can do it to reach me. And so we have to work with our target groups in doing any initiative that we have, because they know what's going to reach them.
All right. A quick question here. Dr. Williams, you still with us? All right.
Yes, I'm still here.
All right. So as I get a comment from Melody, is asking, Vaughn, please ask Doctor about the Deliciously Health product from the ministry. What is that?
Okay, great. Hi, Melody. Okay, so last year we did an initiative within March, which is Colorectal Cancer Awareness Month, and it was essentially a YouTube show. And so we partnered with a nutritionist and a chef, Chef Brian Lumley, and a nutritionist from the Southern Regional Health Authority. And we made a number of episodes of Deliciously Healthy, a YouTube cooking show. And essentially it was foods that we have around the house that are healthy options for prevention and control of non-communicable diseases. It was a short program for each episode. Meals were prepared, nothing fancy, no zucchini and all these fancy stuff. Just red beans, fruits, and vegetables. Zucchini is fine, but I'm just saying things that we have around the house. And we made our healthy fish meals, and these were options. And then Dr. Dawson from the Ministry of Health, our lead nutritionist, would have spoken about the benefits of these foods. So we kind of pulled everything together. And those videos would have been posted on our website, and they're also airing on a number of TV stations as well from time to time. So there are options for healthy eating. And these episodes were just one of the tools that we use to show the public, hey, you can do this. Here's what you can do. You don't need to be afraid of eating. Here are some options for you. So we were happy for that collaborative effort.
All right, that's good, because one of the questions that are one of the comments that consistently come in are people think that eating healthy is expensive. And
Expensive. It
most
doesn't
person
have to
think
be.
people feel like it's expensive and it costs a lot of money
Right.
because vegetables are expensive, or you have these special types of rice, the brown rice and the brown bread and the this and the that and all these different healthier options, but they all seem to be, it's just it's the craziest thing. I mean, people always ask, why are the foods that are so unhealthy so delicious and so accessible? You know what I mean? What's going on there?
Yes,
That's a
there
grand
are
conspiracy.
options. There are options within the food groups, tasty options. It's just about the know-how, and that was the importance of that YouTube show. There are options that are available, affordable options, and varied options within the food group, so people don't get bored of us eating the same thing over and over again.
Yeah.
So that was good.
There's a quick question here. Hey, Doc, from Pesci Rastafari. I hope I pronounced that right. All right. Pesci is asking, hey, Doc, what can you share about eating for your blood type? Is that such a thing? Is there a,
Eating for your
building
blood
something?
type.
Is there like a whole idea surrounding that? Or is that seem something that's more
I
niche?
I have heard about it. It's not, I wouldn't say it's wide scale at this point in time, but I have heard of some opinions as it relates to foods, certain fruits and vegetables that match your blood type. What I would say is that nothing stands alone. So no option for nutrition stands alone. It's always a balance. And so we don't want persons to veer over to say, okay, I will be healthy because my blood type is B positive, and so I will eat blah, 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 and I won't get NCDs. It's always a balance. It's always a discussion with a trusted healthcare practitioner to balance out the options specific to you. So
Yeah.
that would be my answer.
All right, cool. Cleveland Coombs, a big up Cleveland again. Love the comments, them Cleveland. Really appreciate saying, "Me cook my dumplings, yam, banana, etc. Now and again, but not too often. Those foods are good during the winter time. Also, I tried to cut back on food with us, which associate with frying and do them in the oven instead, which is more healthy. Yeah, it sounds like a good plan. I mean, broiling or baking, as far as I understand, obviously the better option. Cause fried food, I don't know what them do, but somehow them Thai Jamaica with fried chicken, it just, I don't know, man. There's just something special about it. But and it's hard to kind of deviate away from it. But it brings me to a question I wanted to ask you, Takese, which is, no, there are many persons who, it's all well and good when you're at home, you can prepare something that's nice and healthy and so on. But a lot of the time, you don't get the chance because if you have to go out and you have to eat something on the road, you grab a meat from a canteen or somewhere on the road, that kind of thing. A lot of the times, you have to compromise because you don't necessarily have those healthy options. But at the same time, I think the messaging would inevitably start filtering down to our cook shops and so on, so that they
Right.
can start working in tandem with persons to offer healthier meals. But what kind of messages would you tell to cook shop operators and those persons around the place who have their meal services and that kind of thing, but aren't necessarily like your big old chain restaurant or whatever, but people who have the cook shop around the road or down the street, that kind of thing? What kind of messaging can you help them to start thinking about more health conscious menu options?
Well, not a nutritionist, right? So
Mm.
let me say that. But
Fair enough,
thinking how
but fair enough, fair
they
enough.
would say, um, I think the thing is that people want to sell their food, right? So you
Mm-hmm.
have to convince them that if you cut back a little on the oil here, so you can still make this thing tasty. That kind of discussion you really would have to have with your operators, as we do with any grouping when we want to. I mean, well, we have in our mindset what we want to change. So we know we want them to offer some healthier thing. We know is that their money, their living, and so you want them to continue to do what they're doing, but you want to work along with them. It's usually about getting them together, kind of finding, or in some cases you might have to do it individually. Um, just find out what it is that they're doing, what it is they have been cooking, what it is, how they use it and stuff, and just kind of work along with it. Because I tell you, you know, I've been through Ministry of Health. We've had the opportunity to do what we call Camp Yellowbird, which is a camp for diabetic children. And of course, you have the children just yeah, I don't like the vegetable, I don't like this, I don't like that, and stuff. And you see, when you do it in a certain, you package it in a certain way, whether it's you blend something, you do something a little different and a little creative, I think 90% of the time, if not more, you find them coming out eating what it is because you've just packaged, you've done something a little differently. And I use that to say that's kind of the work you would have to do with your operators. Understand that, look, we can do this, we can make it, and maybe you just cut down a little. And that's how we would have to work. I don't know that there is, there's not going to be a one answer for all, and it really depends on what that person is doing. And because not because it's a cook shop out there means that they have not been serving healthy. It's
Which
just
is
that
true. Fair. That's true.
as one of your viewers said, just that they will might pack up on the rice and will pack up on the certain things, and so you may work along with them. Usually, it's about the education and giving them some demonstration of what can be done a little bit differently, and it does help and does work.
All right, quickly, I'm just saying, Peshe Rastafari saying, I asked the question on eating for your blood type because it was something introduced to me several years ago while in the Mideast. I felt good following some of the recommendations and believe it would be beneficial to everyone. So I guess that's something for you guys to take into consideration. If there
Sure.
might be something there that we can explore, and the benefits can be, shared to other members of the population, which would be fantastic. So I think as we kind of move to bring things down, I want you guys I want Takese to plug the ministry's website that you have with the different information about NCDs and all the information that they have available and the different things that people can learn and benefit from on that website.
Okay, so it's very important. I know Dr. Williams gave it already, the MOH.gov.jm. When you go onto that website, there will be a link to the NCD website as well as a physical activity webpage. All those have critical information. I know Dr. Williams, I'll just ask her to come in to just give the exact website
Sure.
Go ahead.
address.
So for the yes, Ms. Foga. So for the non-communicable disease and injury prevention unit, it's ncdip.moh.gov.jm. That's NCD as in non-communicable disease, IP, injury prevention, .moh.gov.jm. There we have information on the non-communicable diseases that we've been prioritizing: diabetes, hypertension, cancers, depression. We have a wellness calculator, so you plug in your age and other information about yourself, and you plug it in and you look at screening that is recommended for you based on your age, your weight, etc., and your gender. And we have information, as I said, on these non-communicable diseases. We also have information on injury prevention. And we also put in our resources all of the information, education, communication materials that we would have produced over the time, and persons, including Deliciously Healthy. And persons can log on and look at these products for life and get guidance.
All right, so there you have it, people. ncdip.moh.gov.jm. Jump on that website. You're going to see a whole bunch of useful information that you can use to help inform how you proceed in terms of being able to manage NCDs. Well, preferably keep them away from you. But if you have them, how to manage, how to move forward, how to diet, how to plan your whole lifestyle so that you can, go forward in the best way possible. All right, you were saying, Ms. Foga?
No, I was just saying, and on the website, as I say, you can link to a physical activity web page that all the guides that I tell you, we have all the manuals, various video clippings, demonstration, the recommendations, all of that is there as well. So you can educate yourself on a number of things there. Just download them. Yes.
I guess just to wrap up for persons who may want to know, when Jamaica moves a roll back out, when I go touch back the road, that's what's going on there, so.
As you said earlier, we never stopped.
Mm-hmm.
It's just not in the breath that we used to have it, but
the face-to-face engagement.
We will be doing a lot of more. Just look out, summer is coming, maybe even before, but look out during the summer. You will be seeing and hearing different activities. But of course, part of what we do is partner. And so we partner with different groupings that are doing activities. We have Run coming up that, we work a lot with running events. And, we are now coming back to a place where we can at least do some minimum runs. We have Father's Day run coming up. We work with the different gym areas. We work with Body by Kurt, and we have activities coming up with them at the end of 25th of June. And we continue to just collaborate with different ways to just promote healthy eating. Look for through the same web pages and on our social media platforms. Look out for the videos, different clippings that we have that can demonstrate, highlight or the healthy lifestyle practices, and we'll also tell you where we are next and what we will be doing.
All right, fantastic. Thank you guys for being here. Let me just quickly, again, show some love. Simone Walker jumped on quickly to say, trust me, your environment definitely contributes to your lifestyle choices. I've been involved in weight loss and fitness competitions with my work peers, and it definitely worked. That's great. And trust me, when you have company, that's that's one thing that we should definitely stress as well. Sometimes going it alone is not really the best way to go. When you get together with persons who can, one, keep you accountable, two, motivate you, and three, just make sure that, there's company. You have actually a partner to do the whole exercise and fitness journey with. It does take a lot of the stress off and makes it a lot more bearable and manageable, even enjoyable. So if you can
I just caution if you can, but I caution on that because sometimes you become so dependent
that
on
is
it.
true.
That
I was about to go there. Yeah.
If the person decided not going, you just end up not going either. So there's a balance.
There's a balance. There definitely is. You have to have that individual motivation. You have to know why you're doing it. But sometimes it's good to have a partner to help you. You know what I'm saying?
True. Yes.
All right. So, whole heap of information. Sure, Cleveland, thank you so much. Say it was great being here. We were glad to have you. Thank you for your information, especially how you cook your dumpling and all them, something there. Respect. And thank you for checking in. Shani, saying big up to you again. Thank you for jumping in and just making the conversation and the whole presentation so much nicer. Glad to have both of you guys. All right. With that said, I think it's time for us to wrap. Thank you to everyone who tuned into our discussion, especially those of you who sent in your comments and your questions. And if you have a question and we didn't answer it in our discussion, not to worry. Go send it in anyway and we'll go through afterwards and see if we can get you the right information, okay? Now remember, our audience plays a major part in our show. So if there's anyone in particular you'd like us to have in studio, let us know. We'll try to have that person in studio as soon as possible. Don't forget to follow us on Facebook, Instagram, and Twitter to see who will be in the studio next. All right? Great conversations. You don't know who we could have in here next time. You have to jump online and follow us to see who's going to be here. And while you're at it, definitely jump on the Ministry of Health and Wellness's Facebook, Instagram, all their social handles to see what they're up to. They're doing a whole heap of different things. Just saw something on the page today about introducing support animals to help treat persons and help, alleviate personal, you know what I mean? Whole heap of things are going. I can't even describe the whole thing to you. But jump on it, you will see it. It looks like a very interesting and innovative thing. Maybe that's something we can talk about next time. But for now, we do this every week live on Facebook. I've been your host, Vaughn Davis, and this has been Studio 58A Live. Thank you all so much for joining us, and please have a wonderful rest of the day. Take care and goodbye. All right? Take care.
Bye-bye.
Ladies.
Bye-bye.
Thanks for joining.
Take care. All right.